Obsessive-compulsive disorder is a common, chronic and long-lasting disorder where a person has uncontrollable, recurring thoughts and obsessions and behaviours or compulsions that he or she feels the urge to repeat over and over. Obsessions can often have themes to them, such as fear of contamination or dirt, doubting and having difficulty tolerating uncertainty, needing things orderly and symmetrical, aggressive or horrific thoughts about losing control and harming yourself or others, unwanted thoughts like aggression, or sexual or religious thoughts. Examples of obsession signs and symptoms can include fear of being contaminated by touching objects that others have touched, doubts that you've locked the door or turned off the stove, intense stress when objects aren't orderly or facing a certain way, images of driving your car into a crowd of people, thoughts about shouting obscenities or acting inappropriately in public, unpleasant sexual images, avoidance of situations that can trigger obsessions such as shaking hands. Some of the risk factors that can increase your chances of having OCD. A family history, having parents or other family members with the disorder can increase your risk. Stressful life events. If you've experienced traumatic or stressful events, your risk may increase. This reaction may, for some reason, trigger the intrusive thoughts, rituals, and emotional distress characteristic of OCD. Other mental health disorders. OCD may be related to other mental health conditions such as anxiety disorders, depression, substance abuse, and tic disorders. Glutathione is known as the body's master antioxidant, and it has many functions. Several lines of evidence support the hypothesis that lower cerebral levels of glutathione are associated with increased oxidative stress, and this may contribute to obsessive-compulsive disorder. Numerous factors can reduce your glutathione level, such as deficiencies like selenium, or depletion due to toxic load, such as mercury poisoning from mercury amalgam dental fillings. Some ways to increase glutathione are by taking reduced glutathione at doses of up to 1,000 milligrams per day, taking N-acetylcysteine, the glutathione precursor, at doses of 500 milligrams 3 times per day, the herb milk thistle, and ensuring that you get enough selenium, for example, by consuming 3 Brazil nuts per day. A vitamin B12 deficiency is a commonly overlooked cause of psychiatric and even some neurological illnesses. Common neuropsychiatric illnesses that are associated with a B12 deficiency are dementia, neuropathies, depression, and irritability. Authors concluded that OCD was an early manifestation of a B12 deficiency. You want to take B12 in the form of methylcobalamin in an oral sublingual form. Realize that a blood test for B12 may not be accurate, as food is now fortified with folate and it can give a false reading on the B12 blood test. As B12 is water soluble, it's generally considered safe when compared to fat-soluble vitamins. B vitamins are essential for creating dopamine, epinephrine, serotonin, and myelin. They also help the mind focus. They help hemoglobin hold oxygen and lower cholesterol. Vitamin B is essential to good health. It's also used for energy production in the human cells. B vitamins help to convert food, often consumed as carbohydrates, into fuel. They also help the nervous system function properly. Taking a multi-B complex will help to enhance the action of B12. There are cases of psychosis resulting from a thiamine deficiency. Therefore, adding an additional thiamine supplement to this mix of a multi-B plus B12 may also be of benefit here. DNA methylation regulates gene expression by recruiting proteins that are involved in gene expression or by inhibiting the binding of transcription factors to DNA. The precise regulation of DNA methylation is essential for normal cognitive function. It's important to note that any DNA methylation that occurs as a result of stress or some environmental factors could lead to the onset of obsessive-compulsive disorder. Therefore, learning more about epigenetic alterations of DNA through DNA methylation is crucial in understanding OCD and anxiety disorders. Undermethylated people tend to have more obsessive-compulsive tendencies. and controlling behavior, addictiveness, and can also be quite aggressive. Severe, unshakable delusions, brain fog, etc. are also typical of under-methylators. 98% of those on the autism spectrum at Walsh Research Institute are under-methylated. 95% of those with antisocial personality disorder are under-methylated. 90% of those with schizoaffective disorder are under-methylated. 85% with oppositional defiance are under-methylated. 82% with anorexia are under-methylated, and 38% with depression are under-methylated. Some supplements for people who are under-methylated. There's B vitamins, D-L-methionine, and SAMe. L-methionine and SAMe are often used for under-methylation. A higher L-methionine dose is required than the SAMe, but the L-methionine is much cheaper. Patients also improve with zinc, vitamin C, calcium and magnesium, and vitamin B6. Inositol sometimes helps with sleep problems. Treatment can take months before an improvement is noted though. MSM. Decreases in homocysteine and MDA suggest a potential role of MSM in supporting metabolic processes requiring methylation, such as antioxidant capacity. MSM, an organic sulfurous compound, can be taken in doses from 5 to 30 grams per day. Detoxification is to be expected, so start with a small dose and then work your way up over time. There's many health benefits attributed to taking MSM. The detoxification symptoms of MSM can be reduced by taking it with vitamin C. Garlic is another sulfurous compound, and it also helps people who are experiencing under-methylation. In a study, 48 patients with OCD were compared with 48 healthy controls and found that zinc, iron, and magnesium levels were decreased in the patients with OCD. Only food source iron would be recommended, as synthetic forms are now showing to be bad for health. Zinc, such as 50 mg of zinc picolinate, can have numerous benefits, such as activating enzymes and helping the immune system. Oysters are one of the highest zinc-containing foods. It's the zinc in oysters that's attributed to their sexual benefits. The best form of magnesium is magnesium bisglycinate. In order to determine your dose, slowly increase until stomach discomfort and diarrhea are noticed. Then gradually reduce to find your maximum tolerable daily dose of magnesium. As magnesium is required for hundreds of enzymes to properly function, it can have profound benefits after a few months of supplementation. It may also help to balance and reduce abnormally high levels of calcium, which are found in patients with OCD. Uridine is naturally found in breast milk. It's now synthetically created. Uridine plays a critical role in the pyrimidine metabolism in your brain. In simplest terms, uridine monophosphate promotes neuron and synapse growth and DNA repair. Benefits reported by users include uplifting and stabilizing of mood, reduced stress and OCD symptoms, a reduction in anxiety, and a modulation and normalization of dopamine release. Uridine monophosphate is the best form due to its price and the scientific evidence backing it up. Doses can range from 150 mg to 2 grams per day. It works synergistically with omega-3 and choline in the creation of new synapses, improving brain function. Users report an increase in verbal fluency from consuming uridine monophosphate. Extracted from green tea, L-theanine supports neurocognitive function in several ways, supporting both neurotransmitter function and brainwave activity, and in the case of OCD, helping to calm the brain. L-theanine modulates aspects of brain function in humans by increasing alpha brainwave activity, and this calms the brain. Doses can be from 100 mg up to 1000 mg per day. Oxidative stress describes oxidative damage in a cell. The level of the oxidative stress has been found to be much higher in the fat cells of people with OCD than others. Antioxidants protect cells from oxidative stress. Vitamin E and vitamin C are both antioxidants. People affected by OCD have been shown to be significantly deficient in vitamin E and slightly deficient in vitamin C. You want to take a mixed tocopherol food form of vitamin E. For one of the most powerful natural antioxidants, astaxanthin would be of benefit, or glutathione. Valerian officinalis is a well-known medicinal plant with a long history of use in the world with an effect on GABA. In an 8-week pilot, double-blind, randomized trial, 31 adult outpatients who met the DSM-4's criteria for OCD on the structured clinical interview participated in the trial. In this double-blind and randomized trial, the patients were randomly assigned to receive either capsules of the extract 765 milligrams per day or placebo for 8 weeks. The results of this suggest that Valerian officinalis has some anti-obsessive and compulsive effects. 5-HTP, or 5-hydroxytryptophan, is a naturally occurring amino acid and chemical precursor as well as a metabolic intermediate in the biosynthesis of the neurotransmitter serotonin. Clinicians around the globe for more than 20 years have had success with amino acid precursors, including 5-HTP, for the treatment of OCD. It's recommended starting all patients with 50 milligrams of 5-HTP and then titrate slowly every 2 weeks up to a maximum dose of 200 milligrams per day. Research examining the ability of CBD to treat OCD is still in the early stages. However, some studies have found evidence that CBD may help to manage the symptoms, and many people anecdotally report that they find it helpful. CBD is generally safe and rarely causes dangerous side effects. You could see my other video on CBD for more information about the mood-altering benefits of CBD supplementation. Though the amino acid taurine does not directly target serotonin production, it's still worth noting as it has an inhibitory effect, and this may reduce racing thoughts that are associated with anxiety disorders such as OCD. Doses can be up to 1 gram taken 3 times per day. Inositol, or more precisely myoinositol, is a carbocyclic sugar, and it's abundant in the brain and other mammalian tissues. It mediates cell signal transduction in response to a variety of hormones, neurotransmitters and growth factors, and it participates in osmoregulation. It plays a role in how neurotransmitters work in the brain and throughout the body, including a reversal of desensitization of serotonin receptors, and as such, inositol may have beneficial effects on anxiety and OCD similar to serotonin reuptake inhibitors. Doses can range from 2 to 4 grams per day. Like most physical and neurological imbalances, lack of sleep is implicated. Improving sleep, therefore, can have a great benefit to a wide range of conditions. Alterations in the circadian secretion of melatonin have been reported in OCD. In medication-free individuals with OCD, the nighttime peak of melatonin concentration was shown to be markedly reduced in comparison to control subjects. An individual dose of melatonin can vary greatly, therefore it can take trial and error, slowly titrating up over time to determine the optimal dose for the individual. Other methods of improving circadian day-night body clock can be reducing caffeine and sugar, removing electronic devices from your bedroom, using blue light blocking glasses, waking up when it's bright and going to sleep when it's dark. Be sure to check out my other video on herbs and supplements to help promote sleep, and my other video on melatonin. You could also check out my video on schizophrenia, as similar brain mechanisms may be involved.